There are several things you can do to protect yourself and others from HIV infection. Abstinence. The most effective way to prevent HIV infection is to abstain from sexual activity. Be faithful. Being in a mutually monogamous relationship with an uninfected partner is another effective way to prevent HIV transmission. Use condoms. If you are sexually active, use condoms correctly every time you have sex. Condoms act as a barrier, preventing the exchange of body fluids. Get tested. Know your HIV status by getting tested regularly. Early diagnosis and treatment are essential for managing the infection and preventing transmission. Don't share needles. Never share needles or syringes used to inject drugs. If you use injection drugs, seek help from a healthcare professional about safer injection practices. By following these preventive measures, you can significantly reduce your risk of contracting or transmitting HIV. Section 5. Treatment options for HIV. There is no cure for HIV, but there are effective treatments available that can manage the infection and help people with HIV live long and healthy lives. Antiretroviral therapy, or RT, is the standard treatment for HIV. ART involves taking a combination of medications that work to suppress the virus and prevent it from multiplying. ART helps to reduce the amount of HIV in the body, known as the viral load. It also increases the number of CD4 cells, which are white blood cells that fight infection. Additionally, ART improves the immune system's ability to fight off infections, reduces the risk of developing AIDS, and helps prevent the transmission of HIV to others. It is important for people with HIV to start ART as soon as possible after diagnosis, and to take their medications exactly as prescribed. With proper adherence to ART, people with HIV can live long and healthy lives. Section 6. The global impact of HIV/AIDS. HIV/AIDS is a global pandemic that has had a devastating impact on individuals, families, and communities worldwide. Since the beginning of the epidemic in the early 1980s, more than 75 million people have been infected with HIV, and an estimated 36 million people have died from AIDS-related illnesses. Sub-Saharan Africa is the region most affected by HIV/AIDS. The region is home to about 10% of the world's population, but accounts for more than 60% of all people living with HIV. The high prevalence of HIV in sub-Saharan Africa is driven by a number of factors, including poverty, lack of access to health care, gender inequality, and stigma surrounding HIV. The HIV/AIDS epidemic has had a profound impact on global health and development. It has strained healthcare systems, orphaned millions of children, and slowed economic growth in many countries.